Welcome to Medicare for All Explained. This podcast will enlighten our listeners and dispel the distortions that surround Medicare for All. Medicare for All Explained is produced in collaboration with Physicians for a National Health Program and is hosted and produced by Joe Sparks. I'm your host, Joe Sparks. This is episode 75. Jeffrey Sachs' testimony from the House Oversight Committee hearing on Medicare for All. The House Oversight and Reform Committee had a hearing on examining pathways to universal health coverage, and Medicare for All was a large part of that discussion. In this episode, I play the testimony of Jeffrey Sachs, Ph.D. Dr. Sachs is an economics professor at Columbia University, and he makes important points about the U.S. healthcare system. The data shows that our results are worse than other nations and costs way more. We pay a high price for our poorly performing healthcare system. Note that Dr. Sachs' video testimony is even more powerful if you can see the graphs he displays. I have included a link to a video of his testimony in the description of this podcast. And now, the testimony of Dr. Jeffrey Sachs.
Dr. Sachs, you are now recognized for your testimony, and I understand you're testifying from Berlin.
I am indeed, Chairwoman. We have multiple crises in the world, and one of them, unfortunately, is nearby here. Let me proceed expeditiously for you. Thank you for the hearings. If you could move to the next slide. The U.S. system's completely broken. This is the main point. We are spending a fortune, unlike every other country, and we're getting worse outcomes. This is what needs to be understood beyond the ideology, beyond the anecdotes. We're going broke from a system out of control. And this is from the wonderful Commonwealth Fund report. I think you're going to have a witness from Commonwealth Fund. They do great work. And what you see is the top line is the US spending percent of GDP. This goes up to 2019, about 18% of GDP. Now we're almost 20% of GDP in the most recent data. Look at all the rest of the countries, all of them. We are broken. If you move on. It's the same story. We are broken. Here, all of the other countries have higher life expectancy than the United States. And the gap is widening dramatically. We are broken. We spend far more on healthcare. We get far less because we don't even have a healthcare system. We have a hodgepodge of private, overpriced monopolies, whether for profit or not for profit. I'll say a word about that later on. But this is a broken, unfair, out of control cost system that doesn't deliver. Next, please. So I refer to the Commonwealth report. You could go on to the next slide. We rank last in our health system performance. And we rank last in access to care, last in administrative efficiency, last in equity, last in healthcare outcomes. Let's stop with the individual anecdotes and just look at our system compared to the rest. Next slide, please. This again, we spend more. That's on the horizontal axis. On the vertical axis is performance. The US is that little dot on the bottom right, expensive and poorly performing. All the rest of the countries, less expensive and better performing. Next, please. We spend a fortune in administrative costs. When you go into a doctor's office or a hospital, you spend hours in the end, either before or during or after filling out forms, trying to get reimbursed, trying to figure out what's covered, who's in the network, who isn't in the network. I can tell you, even with a physician and masters of public health, PhD degrees. It's almost impossible to navigate the US system now. And the result is administrative costs out of control, unlike any other country. Next slide, please. Again, we're spending 10, 15, even 20% of outlays on administration. People that are working, hundreds of thousands of people employed, to move between different accounts because it's private this, it's private that. Who's going to reimburse this? Who pays for that? It's unbelievable the amount of time we are burning in order to run this ramshackle non-system. Next, please. The expenditures continue to soar. And in 2020, we reached almost 20% of GDP, basically twice what other high-income countries are spending that are getting the same or better outcomes than in the United States. This is what I would plead for the committee. Look at the rest of the world, not at our own internal ideological bizarre discussion, but at the comparison with what's happening elsewhere, because there are so many solutions abroad. Next. Life expectancy stopped rising a decade ago. It is falling in the United States. When will we understand we're falling apart in this country? And our health system doesn't deliver. It doesn't deliver preventative health. This tragic story of Dr. Blackstock, of a patient who comes in with advanced breast cancer who couldn't afford to be seen beforehand. That's a system. That's the United States of America. It's shocking. And it shows up in the most basic measure of societal performance. No, not GDP, life expectancy, which is falling in the United States because we're becoming completely dysfunctional. Next, please. We are at the top of avoidable deaths, again, from the Commonwealth Fund. If you look in detail at what the cause of deaths are, these are preventable deaths, but the United States has the most of them, and it has the least reduction of them of all of our peer countries. Next, please. Costs for low-income populations. Well, we've heard this repeatedly. Out of control, unlike all of our peer countries. We're the country all the way to the right-hand side. We look different from all of the rest of the countries. Next, please. We have, as you know, an epidemic, even before COVID, of deaths of despair. We have soaring deaths from suicide, from substance abuse, opioid overdoses, and so forth, for people who are battling economically as well. And so you see the biggest rises for the white population with no college degree. This is an absolute shocking epidemic in the United States of America without a health system to address it. Next, please. We have vast differences across the states. Typically, as is true in US politics, the states farthest behind are the ones most defending the status quo. Very sad, but this is how our politics is, absolutely upside down. Instead of a system that could work, we have an opposition to state control, as if we have a functioning market system. Next, please. What we have is a scam going on. Please understand, we have the most high-priced, high-cost system, and we have a system that is filled with its sense of success because they're making a fortune. This is what I clipped from the Wall Street Journal list of our CEOs of our pharmaceutical industry. What do you want? 20 million salary, 25 million a year salary, 30 million a year salary. That's the game of the United States of America healthcare
Dr.
system.
Sachs, you're way over time. It's fascinating.
I'm sorry, could I come quickly to an end? I'll come, just the next slide, I'll come very quickly to an end. Our not-for-profit hospital administrators are making millions and millions of dollars. Next, please. I'll just, forgive me, Chairperson, I just want to make two more points.
All right.
This is an incredibly profitable industry. That's where the high prices go. Next slide. This is the biggest lobbying industry. I don't have to say this in congressional testimony. Everybody knows it. This industry lobbies a fortune and makes a fortune. It is a scam. And we should compare with the rest of the world and see what we're getting. We're wasting $1 trillion a year that is going into administrative costs, high costs for products, for prices, for devices, for hospital care. Thank you very much.
Thank you. The gentleman yields back.
As I mentioned previously, the video testimony of Dr. Sachs is even more powerful. Please use the link in the description to view it. Thank you for listening. You have been listening to Medicare for All Explained. Remember to tell your family, friends, and colleagues about this podcast. Information about Medicare for All Explained can be found at our website, medicareforallexplained.org. The music for this show is Super Bubbly by Jesse Spillane. The logo was created by Lily Sparks. Thank you for listening.